Hello everybody, this is Dr. Justin McCormick here again. Today I want to talk about why we use oxygen concentrators in therapy for headaches and migraines. First, let's go ahead and review what actually causes migraine headaches. As we've talked about earlier, areas of the brain, specifically we call the mesencephalon, they're misfiring. They're not functioning how they should. What happens is that causes your blood vessels to start to dilate and then constrict, dilate and constrict. And that's where we get that throbbing, pounding type migraine headache. Now, that's not what actually causes the sharp stabbing pain. There's a nerve mesh that wraps around the blood vessel. And as those blood vessels are constricting and dilating like this, that's stretching those very delicate and sensitive nerve fibers. When that happens, we get the full-blown migraine. We get the light sensitivity, we get the nausea, we get the sharp stabbing pain behind the eyes. Now, why we use oxygen? Your brain requires oxygen to function, to survive. It's the most oxygen-dependent part of the body. Now, in the air we breathe, there's only about 20 to 25% oxygen in the atmosphere. So when we're using oxygen therapy in our office, we're getting greater than 90%. Once your brain starts getting that fuel that it needs, it can start firing at the proper rate. Once that happens, it slows down the mesencephalon that I talked about, which is in the midbrain. Those blood vessels stop that constricting and dilating, which means that nerve mesh is no longer irritated. Therefore, migraines subside. Most cases, 2 to 3 weeks. Some, if they're serious, might last 4 to 6 weeks until we get this resolved. Many times though in the very beginning people experience a relief almost immediately. So there's some general gists of why we use oxygen therapy in our office and again kind of a review of migraines. So I hope to see you guys soon and I hope this helped you. Thanks.